to just come on here early and do a quick video about something that came up this week with a patient of mine. And it just was a good reminder to help all of you out there who are going for surgeries, whether they be elective or not elective. And what to do for post-op care. So I had a patient this week who came to me and she had had surgery on her hand. And she came to me about, Cass was off a month before she ended up being referred for therapy. So there are some docs that are very conservative with therapy. They sort of let people just sort of figure it out on their own. They give them a couple exercises in the office and then follow up with them in a month and see how they're doing. And that's kind of what happened with this patient. But in that month period, a lot can happen between the time your cast comes off and you actually have a follow-up with that doctor. So in that time period, she had some symptoms and some concerns and, wasn't doing certain things because she wasn't really sure of what she shouldn't do because she didn't want to injure what she had done to repair it. So it's really important, I think, as patients to advocate for yourself, at least one post-op therapy session with a physical therapist, an occupational therapist, somebody that specializes in the area of surgery that you had. So obviously if it's the back, you want somebody that, works with the back. If it's a hand or a wrist or an elbow, shoulder, you want a certified hand therapist. That's somebody that really specializes in that. But make sure that you go and advocate for yourself and say, hey, I know I may not need a lot of therapy, but can I at least have one post-op visit so that I can talk to the therapist, go over any questions and concerns, and then if I need, if I feel like I kind of get into a pickle and I need some extra help along the way, then I have this person that I can go to and that can kind of guide me, because there's a lot of questions that come up post-operatively, a lot of fears, a lot of anxieties, and it really helps to have somebody that can sit down one-on-one with you and work through those areas so that you can move forward rather than stay stuck for a long period of time and then sort of have to start from scratch a month later, or whatever later, 6 weeks sometimes. I've had patients that haven't been sent to therapy until 3 months post-op. And it's just really, sometimes it's a doctor's preference. And, a lot of times people do okay without doing any therapy, but I think at least a check-in with a therapist post-operatively is really a good thing for you to ask any questions, because there's always questions that people have after surgery. There's only so many things that you can think of pre-operatively when you're in with a physician. There's so many other things that are going on and that your mind is thinking about, and that you're worried about the surgery rather than so much about the post-op care and what to expect and what to do, and all those things. So advocate for yourself and just say, hey, I want to have one visit at least, just to sort of check in and see where I'm at and if I have any questions or concerns. And then they can really go over everything with you, answer questions, kind of guide you along the way, and get you going sooner than later, because you have a very kind of fine window where you can really maximize your rehab process. So the sooner you get going, the sooner you're going to get better. So if you have any questions, please comment below. I'd love to hear from you, and advocate for yourself. All right, have a great day.